Thank you for joining us once again as we talk about glucagon-like peptide 1 agonist, also known as GLP1, an example being semaglutide and its role in weight loss, and also to find out if these medications, such as semaglutide, will be ideal for you as you seek and explore healthy and safe ways to lose weight. My name is Stephen Anson. I am a nurse practitioner with extensive background in emergency medicine and primary care. I also work with the online practice called Telehealth, Weight Loss, and Wellness. What are GLP1 or glucagon-like peptide 1? These are naturally occurring hormones produced by our gut or intestines, and they do three primary things or goals. What they do is they regulate our sugar levels in the blood, they also suppress our appetite, and they also help with metabolism. Now let's talk a little bit about their role in regulating blood sugar. Anytime we eat, what happens is these GLP-1s levels get increased, and what they do is they end up having an effect on our pancreas. The pancreas is one organ which is responsible for producing hormones such as insulin and glucagon. Now, the role of insulin after we eat is to reduce sugar levels in the blood or glucose levels in the blood. So what happens is when GLP-1s is increased, it works on the pancreas by increasing the insulin level, thereby reducing the sugar or glucose level in the bloodstream. The way it affects glucagon is in a system we call the negative feedback mechanism. That is, as insulin levels are increased, glucagon, which is another hormone produced by the pancreas levels, are decreased. And what that means is because glucagon is needed to increase our sugar level, and the fact that it's now decreased, that means that we will end up having less sugar or glucose in our bloodstream. The second role of its effect on metabolism is it reduces gastric emptying. So what that means is it reduces how much or the frequency with which food leaves our stomach or our gut. And the fact that we have slow release of food from the gut means we will have less sugar being absorbed or less glucose being absorbed into our bloodstream. The way it works on appetite, which is the GLP-1 on appetite, is it has an effect on part of the brain called the hypothalamus, and it kind of suppresses our appetite, eventually suppresses our appetite, and also makes us full. We feel full. So primarily, these are the three ways by which GLP-1 kind of helps or regulates our sugar appetite and metabolism, and eventually helping us lose weight. Let's try to also address the issues out there where, those who don't like the idea of people using GLP-1 agonists such as semaglutide in losing weight, and the argument being put forward out there is these patients or these individuals are trying to find a shortcut to lose weight. I disagree with this notion, and I think it's far from the truth, especially when you don't have the full picture of why people are trying to find alternative ways to lose weight. For example, some people or some patients might have tried lifestyle modification, might have tried reducing calorie intake, dieting, exercise, but for some reason, none of these is helping them lose weight. For others, it could be a hormone issue. For example, some people just have an imbalance of their thyroid hormones, and sometimes these affect their weight gain, or it affects how much they try to lose weight. For others, they probably need a little bit of help. So using semaglutide or GLP1 is just one tool in the whole toolbox to help people to lose weight. It's not the whole story. So you can be on GLP1, but then if you don't support using a GLP1 with lifestyle modification, you will still have challenges losing weight. For others, it could also be that they have comorbidities such as diabetes, hypertension, some because of their weight gain may have preclinical signs such as shortness of breath. For others, it could be knee pain because of their weight, and they just need some help. So how would you know if it's about time you try a safe alternative option such as the use of semaglutide? You need to be screened. You also need to have a goal why you think you need to lose a few pounds. Is it for health reasons, or is it for you to be able to do the things that you used to do before, go scuba diving, be able to be active, again. So if it's about health issues, then you need to be screened to find out, for example, what your BMI is. So a BMI of a body mass index of 27 and up could be a start that you could try GLP1 medication, probably after you've tried other options. Could it also be that you have other health conditions like we spoke before? So the screening will come down to, for example, asking questions such as do you have thyroid issue, or thyroid cancer to be specific. So any patient with history of medullary thyroid cancer might be advised not to use this medication, or history of pancreatitis also, because the whole idea is for you to get better and not to make your condition or situation worse. If you are diabetic and you are on medication such as sulfonylureas, like glipizide, or in another form of insulin, that means there has to be an adjustment to some of this medication which you're already on, as you try to add GLP1 to your medications. If you are pregnant or you are seeking to become pregnant in the next 3 months, then of course this medication might not be for you. A patient, for example, who has diabetic retinopathy, this medication might not be for you as well. So it comes down to what your medical history also is, and also what your goal long term is as you try to seek this medication. Usually when you finally decide that this medication is for you, and after pre-screening, it is found out that yes, this might be a safe option for you, Then the question is, how do you start this medication in terms of dosing? So, of course, some people are worried. Those especially who've never tried GLP-1 medication, the advice would be to start on a low dose. So for semaglutide, a low dose, depending on the manufacturer. So a compounded GLP-1 semaglutide, a patient who's never used the medication before probably should try 0.125 or minimum 0.25 milligram for the first 4 weeks, and see how much this person tolerates the medication. Now, if you've never used this medication, then the discussion should be had as to some of the side effects which comes with this medication. So some of the side effects could be nausea, could be vomiting, could be diarrhea. And when you do experience sometimes abdominal pain as well, when you do experience these side effects, a few times they do go away, but if it persists and becomes worrying, then it's about time you let your health practitioner or your prescriber know. And usually when that happens, what could help might be just to prescribe an antiemetic such as Zofran to help you, to control some of these side effects or symptoms. Sometimes it could just be the route of medication. So it could be the way how the medication is being injected. Remember, this medication is injected subcutaneously, which is under the skin. So even though most times, the idea is to inject it, by the inject it at the stomach site or the belly site, the skin, outside. If you do experience symptoms such as nausea, then probably we just have to change the site of injection. So maybe below the upper arm or the thigh. And sometimes this might help reduce the symptoms of nausea that you probably have. Sometimes we probably just have to scale back. For example, if you are on 0.5 milligram and you're having nausea, diarrhea, vomiting, maybe just reducing the dose to, a little bit might help address these symptoms as well. So for the first 2 weeks, for the first 4 weeks, I must say 0.25 milligram is the recommended dosage. And then depending on how well you do with 0.25, that is in the absence of symptoms such as vomiting, diarrhea, then we could titrate up to 0.5 the next 5 to about 8 weeks, and then from 9 weeks to about the other 12 weeks we can titrate to maybe 1 milligram. But again, there's no rush, because remember, it didn't take a day to gain this weight, so it has to be a process. So there's no rush to move quickly from 0.25 to 0.5 to 1 milligram. It has to be a gradual increment or adjustment. And usually, we work with you to see how much weight you're losing, and for us to receive feedback by sending us your weekly or bi-weekly weights and diet plan, and see how much this is working for you. Pretty much we work with you. Sometimes you are never alone. Sometimes we might just also give you some vitamins, B12, to help mitigate some of these, side effects or symptoms. So you never alone in this weight loss journey. We work with you until you finally get to your goal. And we will also be working with you to, address issues such as your dieting. And also we recommend that during this use of medication, you making sure you hydrating enough, you drinking enough water. This will also help reduce some of the symptoms. And also try not to eat fatty and big meals before you sleep, because sometimes that might make you start getting some symptoms, as this food will sit in your stomach longer, and it doesn't really help. So if you do have questions, leave your questions in the comment section or send us an email, and we will try to address it. Thank you for watching.